Welcome to our very first presentation for the OutServe Knowledge Online program. We're featuring Make the Connection today. We're all very excited. So as I mentioned a few minutes ago, my name is Kai Blevins. I am the Director of Education, Chapter, and Veteran Services for OutServe-SLDN. And the OutServe Knowledge Online program is a new program that we have where we're bringing critical information to our members, which are LGBTQ service members, veterans, Department of Defense civilians, and their families. And we're doing that through events like these, and also by creating an online hub of information and resources that are really specific to our community. So before we get started, I'm going to go over a few housekeeping things. So first of all, we'll have a Q&A at the end of the presentation, so you can ask Koby questions about Make the Connection then. I want you to also know that the presentation is being recorded. So if you aren't comfortable asking questions yourself, or if you have other questions that come to mind that, and you've already asked one and you don't want to ask anything else, you can send them to me through the chat function, or you can post your questions on the event page on Facebook, and I'd be happy to ask those for you. So now, Make the Connection, you might see in the chat function if you're logged in. So it's a campaign that connects veterans and their family members and friends with mental health information, local resources, and inspiring stories of recovery. We're really excited to have Make the Connection today to talk about mental health, since this is something that hasn't been talked about a lot in our community. And we really want our fellow LGBTQ military community to have access to these resources. And so Koby South, who's presenting today, is a project manager and strategic communication specialist in the Department of Veteran Affairs Office of Mental Health and Suicide Prevention. He manages the national award-winning Make the Connection program, focuses on public health issues such as suicide and mental health stigma, and he's worked at the VA since 2009 on several campaigns, including Make the Connection and the Veterans Crisis Line. And with that, Koby, do you want to take over now?
Yeah, thanks, Kai. I appreciate the introduction. And hi, everybody out there. I'm excited to talk about a couple things. Primarily, we're going to focus on Make the Connection, but before we do that, I just wanted to give a little background and some upfront resources related to the VA's Office of Mental Health and Suicide Prevention. You know, obviously, the title speaks it all. The office has been, reorganized with suicide prevention as a primary focus. It's been, the previous secretary's focus, both Shulkin and even all the way back to Shinseki, and prior to that, suicide prevention has been really a major focus, and really this office now, with this organization like it is putting just a ridiculous amount of resources into finding ways to prevent veteran suicide. So, I'd be remiss to not mention the Veterans Crisis Line, which I hope everybody is aware of. But, the Veterans Crisis Line provides 24/7 confidential service through both a phone and chat. And, we'll connect veterans in imminent crisis with trained professionals. They hook people up with both VA resources and will help assist with community resources. And then I also wanted to point out one of my favorite programs that doesn't get a lot of recognition or promotion, so I tend to speak about it very frequently, and it's called Coaching into Care. And Coaching into Care is a free VA service where a family member or a concerned friend or loved one of a veteran can call trained professional counselors and get advice, recommendations, and eventually, hopefully, solutions to encourage the veteran loved one in their life to actually reach out and get support and mental health treatment. So those are obviously two extremely important programs in the Office of Mental Health and Suicide Prevention. One other thing I'd like to mention is also under Office of Mental Health and Suicide Prevention, and it seems to be a strange fit, but we're learning more and more about the pretty devastating impact of tobacco and primarily smoking on mental health, and how quitting tobacco can play a significant, just a huge role in people's recovery from mental health conditions. People kind of have this very false assumption that smoking cigarettes, and most of the research right now at this point is based on smoking, but that smoking a cigarette while you're dealing with a substance use disorder or, getting mental health treatment will help with anxiety, will help with the stress. And it actually, all you do is just jumping from one kind of withdrawal episode to another, which exacerbates anxiety and stress. And people actually have better recovery outcomes when they stop smoking, and they can even be stop smoking in conjunction with, initiating some sort of treatment. It's really quite, amazing the research that's come out recently. If you're interested in learning more about that, actually, we're doing a Twitter town hall next week with people like the American Cancer Society, VA, a whole bunch of other amazing agencies and departments talking about smoking on World No Tobacco Day, which I'll have to get that date. I think it's May 31st. It's the last day in May. So if you look for hashtag WNTD, World No Tobacco Day, you can follow along. And I think that's at 1 p.m. Eastern, but we can email people on the call some information about that. Again, the research related to smoking and mental health issues is just amazing. I think anybody interested in recovery, it should really, get up to speed on some of this research. And along with, the tobacco and health stuff at VA, there's two really great services. One is a phone line where you can speak to a counselor and get help getting a quit plan, a treatment plan for how you quit, whether it's just, going cold turkey, which is probably not the most recommended method, or it's between counseling and actually medication. There's some pretty good medications out there now that can help deal with cravings. And then a text program where it's just an encouraging series of texts that kind of keep you on track with your quit plan. So with that, I'll go ahead and talk about the real reason why we're here, which is the Make the Connection campaign. And as Kai kind of alluded to, this campaign is really about veterans sharing their stories of strength and resilience and inspiring others to seek support, as the slide says. What I would tell you is, back in 2011, in the beginning of that year in January, along with myself and some mental health professionals at VA and other people interested in this topic, we came up with the idea that, we really needed to directly confront the stigma in this country related to mental health conditions and mental health treatment. And we did a lot of research for about 6 months and, wrote a pretty extensive strategic communication plan. And basically what the research says is if you're doing anything public health related, if you're trying to change people's pretty much very deeply ingrained opinion about something, and that's something for us, especially when it comes to service members, is that, reaching out for support is not necessarily what you want to do. You're supposed to be the army of one. You adapt, you overcome, but it's kind of like this self-reliance model. And we really know that it's actually not a sign of weakness to ask for help, and that it doesn't go against anything that you learn in the service, whether it's the Marines, the Army, the Air Force, the Navy, is that, it's really about team building. It's about relying on a team member. We film veterans frequently, who speak about the camaraderie and how important that element is. So we really wanted to capture that. The best way, again, that the research said that you capture that is a peer-to-peer model. So basically a veteran telling another veteran, hey, I got treatment, dude, or, you need to come over here and do it as well. Or, telling a friend. But that obviously is a very expensive model to hire. And the VA does employ peers at hospitals, but to go like door to door and try to encourage veterans that aren't in treatment to come to treatment would be pretty, both logistically challenging and financially challenging. So, we thought, what's the next best method? And that was to film veterans and make those videos available to everybody else. And so, over the last 2011, 6 or 7 years, we've basically crisscrossed the country and, filmed in just a ton of different, over 25 different cities. I think approaching close to over 700 veterans now, talking about mental health challenges, talking about transition challenges. It's not just like talking about depression or military sexual trauma or PTSD. It's actually even just down to like just transition challenges. I lost my spouse, or I lost my partner. I lost my house. I dropped out of school. I failed out of school. I got kicked out of school. A lot of these transitions can really exacerbate or, may even initiate a mental health problem. So, with Make the Connection, we have to get out in front of a lot of these challenges and let veterans know that, hey, you're not alone. People have gone through this. They've gotten help. They've gotten support, and they're doing better because of it. Moving on, one of the things and I think one of the reasons that OutServe and Kai has us on the phone today is we're right in the middle, or sort of in the middle, on the tail end of the middle, I guess you would say, of Mental Health Month. And during this month and every month, the VA really takes kind of a prominent role, and tries to really elevate the conversation. And one of the ways we elevate the conversation is with people, supporters, organizations that have a vested interest and are concerned about mental health in general and the stigma in this country, and are with us, with VA, and veterans in particular. The nice thing about working at the VA on things like mental health stigma and promoting these amazing stories, and I cannot stress that enough. If you watch some of these videos, literally a lot of them will make you cry. They are so inspiring. They are so inspirational. But what's cool about it is that people really look up to veterans as leaders in communities, as people that have, whether they were deployed in combat or not. If you sign, if you take the oath of service, you have right at that moment said, I will die for my country. I will defend the Constitution with my life. So no matter what you experience, you have said that you are willing to do that. And so people really look up to veterans. So for veterans to come forward and say, I've gotten treatment for depression, I've gotten treatment for PTSD, I've gotten treatment for trauma I had when I was a child that has nothing to do with my service, it really goes a long way to changing the entire narrative in this country. And so it's an amazing thing to promote something like this, because what it does is it really helps the entire country. And so Mental Health Month is all about that. And what we're doing this month is promoting a campaign within the Make the Connection campaign. That mental health means a stronger you, basically. But it goes beyond that, in that, the mental health means we've left kind of open-ended. Mental health can mean a variety of things to people, especially the veterans that we filmed over the years. I mean, it can mean the difference between getting an education and, a career. It can be the difference between strong relationships with your children, or your father, or your mother, or your spouse, or your partner. I mean, it can just mean so many things that have such a positive impact on how your life, the trajectory of your life. And so this month, and I'll show you, I encourage everybody to go check out our splash page for mental health. We've featured a variety of veterans talking about what mental health means to them. So whether it's a healthier outlook, or stronger relationships, or a balanced life, we've featured just all these great, really amazing stories: reaching new heights, giving back to your community, taking back your life, finding peace. So just some really, really great stories, some resources related to that. Like, so, okay, great. Mental health means these amazing things. So what do I do? And then, so we give you some really good ideas about what you can do, and they don't have to, like, it's not these big, massive things a lot of times that really matter. And a lot of these things are, whether it's about yourself, exercising, if you are experiencing depression, as research has shown, is one of the most effective sort of activities to help alleviate some of the depression symptoms. So there's things about, supporting yourself, supporting others, just being, thinking simple. Talking positively. I think, recently, and it was just such an eye-opener to me, we had a YouTube live event related to Mental Health Month, and you can actually watch it on our YouTube channel, on the Make the Connection YouTube channel. And one of the participants, who is a Marine veteran, basically said, a lot of times he just has this self-negative talk, and he caught himself, getting down on himself, and he was just amazed how he would speak to himself. So he decided to change his perception and say, I'm not going to talk to myself if I don't talk to other people that way. And he said it just had such a profound impact on how he thought about on the negative self-talk and trying to kind of arrest that. So anyway, I invite you to explore the Mental Health Month splash page during the month of May, and would point out, though, that, mental health, the promotion of positive conversations of mental health and treatment and mental health conditions is not kind of a monthly thing. It's something we need to do all year, every year, until we can really change the narrative in this country. Moving on here, we do have a number of videos that we tried to work out through the BlueJean app, but it really didn't. So what we're going to do is email a few videos to the participants later today. This video was for Mental Health Month, and that we asked these veterans who we had previously filmed interviews for, what mental health meant to them, and really the benefits that treatment provided, which I pretty much covered earlier, the relationship aspects, kind of the trajectory of your life, whether it's a career or education. But now at this point, what I'd really like to do, because I think it tends to, get missed a lot of the times, is that when you do a presentation like this, if you're just doing slides, then people go, oh, website, yeah, I'll check that out later. And nobody really ever gets a chance. And so what we like to do is, do a few PowerPoint slides and then actually show people the website, because there's some really neat functionality that parallels, and we didn't just do the functionality for cosmetics or for a wow factor. It really parallels with the research that we did when we started Make the Connection. And part of that research, again, goes back to the peer-to-peer aspect. And so we just continued to take it one step farther, in that when we developed this website, we wanted a veteran or even a family member or friend that was concerned with the veteran to be able to come to this site and then find videos that were relevant to them. And it's not just relevant, oh, they're a veteran. It goes beyond that. So what you'll see is we've actually allowed for people to sort not just the pictures and the videos, but the actual content of the website based on some pretty specific criteria. So when you served, which actually ends up in a lot of instances aligning with your age, so all the way back to World War II. So if you were to do the Vietnam era, what you'll see is that video is actually changing. I don't know how slow our platform is, but it actually brings up now a video of a Vietnam veteran. And then, we all know that the Marines only trust Marines, so you can actually, sort on your branch of service. So if you did, Vietnam and Army, you're going to see, again, it may be the same video because he's an Army veteran. This person that's featured here is an Army veteran. But you can even do, gender. So what you'll see again is that it changes. And so, just taking really that peer-to-peer evidence and research to a whole new level. Like, this is a personalized experience that's supposed to encourage somebody dealing with whether a transition issue or a mental health condition, to connect with somebody not just to look like them, but who has experienced similar things. And then, throughout the site, you'll see, as I said, it's not just like kind of confronting you right up front with PTSD or depression. We actually start off the conversation with these life events and experiences that can have kind of a significant impact on a person's mental health. Some people are able to go through transitions with kind of less hiccups than some of us for some reason. That we don't really know why, but some people can get caught up with, a relationship issue. Obviously, if you're dealing with a financial issue, that can have a really significant impact on your mental health, whether you're about to lose your house or, you've got a lot of credit card debt and you're in school. There's veterans that talk about how, they got past kind of these financial and legal troubles. The legal issues deal with, things like even up to going to prison and getting assistance through VA's vet court program. So there's a lot of really great information there. There's also a lot of great information on all of these kind of life events and experiences. And then, we do get into, you kind of do actually start to ease into kind of more mental health stuff, but we've always kind of put an eye toward being careful about being too jargony. So things that like a mental health professional would call hypervigilance are basically feeling on edge. It's that veteran kind of action where they, action not being the right word, but behavior where, they're aroused. They know that when they go to a restaurant, they sit with their back to the door because they're, looking for all the exits and kind of scanning the room. Or when a veteran is driving down the road, especially the OEF, OIF, OND veterans, they're always kind of looking at trash next to the road because they're so hyper aroused and hyper vigilant about the potential for IEDs. So, we don't call it hypervigilance, we call it feeling on edge. And so you'll see that there's kind of those signs and symptoms. And then, we do eventually have to talk about mental health conditions. So whether it's anxiety, bipolar, depression, military sexual trauma, a substance use disorder, schizophrenia, PTSD, etc. But really the most important part, and I'll kind of jump around, but we will have lots of time for questions. The most important part, though, to me, is the video library, the video gallery. That's why we started initially the Make the Connection campaign. We wanted to capture these stories of recovery, and we wanted to give other veterans out there who thought they were alone, this experience, this place that they could come to that really exhibits the fact that you are not alone. There are men and women out there that have gone through, significant trauma, have gotten help, and are doing better because of it. Everything from, abuse when they were children, whether it was neglect or other things, to things that occurred in service, and it doesn't even have to be related to combat. That's one thing that we really want to stress with this resource, is these are not combat veterans. Only a small percentage of veterans actually ever serve in a direct combat MOS. I think the number I heard was 10%. So really 90% of veterans served in a support capacity. Now that doesn't mean that they didn't experience combat. A lot of support personnel in the service obviously go through a lot of combat trauma, whether it's a nurse or a truck driver. But really, this is the human experience encapsulated and told by veterans, dealing with things that many of us have been through and then getting help. And the other thing that I would point out is it's never been a requirement for us to actually film veterans that get treatment at the VA. We want veterans, we've filmed veterans who have gotten what we call evidence-based treatment. So if we're going to film you and you're not getting treatment, or you didn't receive treatment at the VA, it has to be something that the VA recognizes as effective. And so that could be, CBT, different sorts of cognitive behavioral therapy. That could be just medication. That could be a combination of medication and counseling, et cetera. But it doesn't have to be through the VA. What we have found, though, is even though that wasn't a requirement, we didn't recruit through the VA. We usually recruit through organizations such as OutServe and the VFW and American Legion and Disabled Veterans of America and other very specific regional or community sort of organizations. We found that most of the time, veterans that we filmed were getting or had received treatment at the VA, and it had been very good. The mental health treatment had been very good, and the health in most cases is very good. What you see is kind of what all of us know, is that the benefits side needs a lot of help. So what's cool about this video page is, as you can see right here, if it'll highlight sort of in real time, is that it's a lot of video. It's 727 videos, and that's just way too much for somebody to go, oh, let me try to find something that I can kind of resonate with. That whole aspect of the filter is built here too. So if you just do, era and go to Vietnam again, you drop to 162. So that's like, then cut quintuple, or however you would say that. If you do branch again and just do Army, it's going to drop pretty significantly again. If you do, post 9/11 and Army, and you do, gender, you'll see that it drops pretty significantly as well. And then the nice thing about this, so on the homepage, you just kind of get that kind of higher level filter. We've built in really granular filter into this, and you can get to a place where you're never going to not see a video, but if you go too far filtering, you'll get video actually that may be a little less relevant. So if we just do Army, female, and post 9/11, and then did military sexual trauma, you'll see that number is going to drop down to 7. And so hopefully you'll find something here that resonates with you. But if you take off the branch, and I just took that off, it'll actually pop that number back up to 19. So what you'll see is, you can really get specific in what you're searching for. Now, we have filmed so much in an effort and an attempt to make it so somebody can find something that relates to them, but that takes time. We are still filming. We just filmed recently, and it's all, I've actually been to like almost every single filming, and I lose track. I think we were in Phoenix and Tucson just recently, and we're going to Detroit and New York in another few weeks. And then that'll be the end of filming for us for this fiscal year. But next fiscal year, which I think is fiscal year 19, we're going to be filming again. And a lot of times we try to, especially now that we've built out the library so significantly, we try to focus now on special populations that tend to be a little less likely to come forward. And I think recently when we were in Tucson, which has a fantastic support system for transgender veterans, we filmed, like I think 8 or 10 veterans who had either transitioned or were, right in the middle of their transition. And so that was a focus for us in that area, just because of the great services that the VA offers there, and the fact that a lot of transgender veterans have moved there because of that. And then, we have a focus this year. We also had a focus on just LGBTQ issues and veterans in general. And so, again, Tucson, Phoenix area was a good place for that. And then New York will be good for those veterans in those areas. But again, you can get really, really specific on how you sort for certain things that hopefully match what you're looking for. And with all that in mind, obviously, you don't really want to just leave people, okay, I found a reason to get treatment, and I see that I'm not alone and that other people are doing better. So what do I do now? So you can actually find, we have a resource locator. And the first one, we actually have 3 resource locators that you can see on these tabs. But the first one by default is the VA one. So and I'm actually located out in New Mexico. If you, just enter your zip code, and you can say, you want to find medical centers and outpatient clinics and vet centers, and just do all VA resources, because New Mexico is very sparsely populated. And then hit select, you'll see that, not only do you get the resources listed on the left, and listed in with the information like the distance, the phone number. They're also shown on a map here. I think this is just plugs into the Google Map app thingamajig. So there's that, so you can find the resources in your kind of in your vicinity. But we've also partnered with SAMHSA. So if you don't want to go to VA, maybe you don't qualify for complete free VA care, the SAMHSA Behavioral Health Treatment Services Locator, which is a mouthful. You can also enter your zip code on this one. And the great thing about the SAMHSA locator is that it's vetted by SAMHSA. So these resources are totally legitimate. They practice evidence-based substance abuse and mental health treatment practices. So you know that whatever you find here, and I didn't select anything, and I broke it. I've never broken it before. So cool. So we'll see what happened there. Anyway, so if you, select all, and SAMHSA is just mental health and substance abuse. I don't know what's going on with that, but we'll look into it. It may just be the Blue Gene app. It's blocking that for some reason. And then we have the National Resource Directory, which is actually a whole bunch of resources that are not just related to mental health. You have things like benefits and compensation, community of care, homeless, housing. These are not like geo-targeted though, so you can't enter your zip code. So searching for things in the National Resource Directory is a little complicated. That's actually the NRD is a partnership between VA, Department of Labor, and Department of Defense. And so all 3 of these big departments come together and try to vet and organize just a massive amount of data across the United States related to these programs that are generally focused on veterans or service members. And so I think that is, and one other thing that I'd like to point out is we've kind of moved into this area of a little bit more written sort of content. So a lot of the videos that you'll see, we've started to kind of reposition, and then we've kind of in almost a blog format. We call it what's new, but it's not just based on veteran interview stuff. We do things like, I don't know what they're called, like listicles. So like, 6 sources of support right in front of you. We've got another example would be, 4 ways to make a difference during Mental Health Month. But then, things like when the effects of sexual trauma persist. So featuring, what veterans did. And we have filmed both men and women who have experienced military sexual trauma. So what men and women have done when, that trauma really starts to ruin their lives, and the treatment that they got, and what they did and how it helped them get back on track. So there's sort of these articles. It's cool. I like this, that, it tells you how long it'll take you to read it. So, I got 4 minutes before my next meeting. Cool. I'm going to read this neat little article. And so like mental health recovery by the numbers, it just kind of gives you an idea that, these different little data points they're pretty interesting. And so I think, that's it for the site. Definitely, hopefully you guys have some questions when I finish up here. We'll hop back over though, quickly to the presentation. There we go. Again, like I said, we filmed in a ton of cities. This just lists a few of the most recent ones. LA, San Diego, those were 2018. Phoenix, Tucson, 2018. And we're going to be coming up Detroit and New York soon. And then the gray dots that don't have, dates are basically all the other cities that we filmed in. And a few of them we filmed twice, just because we go to places where the veteran density concentration is pretty high, because it makes it easier for our recruitment. And then one other thing I'd like to show is, we wanted to play this video. It's actually a compilation. It's a LGBTQ veteran video that really, features a variety of veterans talking about, kind of specific LGBTQ instances, issues, challenges. For example, Tim, which you can see right here, really struggled while he was serving because he served under Don't Ask, Don't Tell. And it really, kind of messed with his identity to where he felt like, people's lives were in his hands and people were trusting him with their lives, and he was trusting people with his life, and he couldn't reveal one of the biggest parts of his identity, which was his sexuality. And so when he got out, he went back like 6 or 8 months later and started telling the people he served with. And I really recommend that you watch Tim's video. It's amazing, the reactions he got, and most of them, as many of you might guess, were thankfully positive, very supportive, which is not always the case, but in this one it was. So that's a great video we wanted to show you. And Tim's video really is just one of quite a few that we now have on Make the Connection. And that one quick other thing I would point out is, at this point, you can't really sort on the Make the Connection site for LGBTQ videos, but we're working towards figuring out a way to do that and where that kind of fits in, because obviously that is not a mental health condition. It's not a mental health symptom, but it can be a very significant life event or a transition challenge, like serving under Don't Ask, Don't Tell, the whole experience of coming out to your friends and your family. All of that can play a significant role, and even kind of suppressing that before you kind of learn to come out to your family and friends and navigate that kind of new identity can play a pretty profound role in your mental health overall. And so, here in the next few weeks, we're going to have a page and the ability to sort for those videos so that it'll be easy to find veterans talking about their issues related to that, to their sexuality. And then last but not least, not only do we have a website, but we have a very robust social media presence, and it's actually very, very positive. Obviously there's been a lot of negative press with Facebook, but our Facebook page has over 3 million fans, and it's really just a community to talk about mental health treatment, mental health recovery. We've really gotten, over the last few years, worked really hard at cultivating that and making sure we maintain that. We monitor the page 24 hours a day, 7 days a week, 365 days a year. And one of the reasons we do that is because these are people talking about mental health. And we know that veterans who haven't gotten treatment may come here, and it may cause them to have some sort of, kind of trigger a man or a woman that's had tough issues, to kind of maybe reach a crisis point. And so we monitor it for that. And if we see that a veteran or anyone really, but if it appears to be a veteran or, and they're really struggling and they post something like, I can't take it anymore, and we have a very low threshold, we'll immediately bring in the Veterans Crisis Line. We have, obviously working at the VA, a direct relationship with them, and we bring them in on Facebook, and they are relentless in hunting veterans down who are at imminent crisis. And hunting down kind of has this negative, it's probably not a great choice of words, but they will find a veteran in crisis and make sure they're safe. And if you are a veteran in crisis, and some people don't know this, you could actually receive services at the VA pretty much the same day or the next day. And they've really expanded that to the point that if you walk into the ER as a veteran and say, you're in imminent crisis, they're going to get you seen like immediately. There's no waiting, there's no line, you will be seen by a mental health professional. And so we just wanted to point that out. I skipped a few things. With the Facebook page, we've had, like 57 million post engagements, over 8 billion impressions of all of these amazing stories. I think our videos have been viewed between, doing native Facebook video and some video on Instagram and YouTube over 50 million times. So, this is kind of not your normal government campaign. We never rap. We never try to be hip. These are just real stories of veterans that have faced some pretty significant issues in their life and have gotten treatment and gotten better because of it. We have, Facebook, like I said. We have Instagram. We're on YouTube. And, one of the other things, like I said, is that we monitor the page 24/7 and refer people that need help. We also, it's not just about crisis. Usually we encourage people to ask questions related to mental health, but if somebody comes to our page and say, hey, I'm really interested in the GI Bill, we'll send them the link to the information. And so we'll actually answer almost any question within an hour unless we don't know the answer. And, we've done that over 18,000 times, and we've helped roughly 250 veterans who appeared to be in crisis, and hopefully, got them help through the Veterans Crisis Line. And so I think actually that's it. At this point, I've talked way too much. I'd love to hear some questions if anybody has any.
Thank you so much, Koby. This is Kai again. So yeah, if there aren't any, are there any questions right now? Okay, I'm not hearing anything. I'm going to go ahead and ask a question, and if anybody else has other questions, please jump in. So the first one actually comes through our Facebook page. We have an anonymous question asking, do you only assist veterans that have a service-connected mental health concern, like depression that's not related to service, but they're still a veteran?
So, so I don't know if that's like a VA question or like a make the connection question, because with make the connection, it's more about, changing the conversation, encouraging veterans to get help. If it's kind of a VA specific question, I'm definitely not an expert in that arena, but whatever your condition, it doesn't matter when it occurred. It just matters whether or not you're eligible for VA care, which is kind of a complicated algorithm, for lack of a better term, and a lot of that is dependent on how much money you make. Some of it is related to whether or not you served in combat, but I don't think that plays like as big a role as people think. And so, if you match all that, and sometimes, it's not 100% free. You may just have to pay a copay, which is way less than my copay. I think that copay is like in the neighborhood of $20. So that's a certain eligibility level. But nonetheless, all of that being said, if you have depression from your, earlier, prior to service or whatever, you're still going to get treated for depression. It does not have to be service related.
Okay, awesome. And to kind of follow up on that, for the videos that are up on the website, do they address just service-connected mental health issues or everything? Okay.
Yeah, no, that's the great thing is, what we'll see for like one really good example is we don't have a lot because it's so hard to encourage these veterans to come forward, and they're really hard to reach, but we do have some veterans talking about dealing with and living with and managing schizophrenia. Schizophrenia is obviously, could be triggered and could be that there's some precipitating event while you're in service that really kind of makes the schizophrenia come out, for lack of a better term, really become more significant. But maybe not, but what we know is that, you don't get schizophrenia from serving in the service. Also, we have lots of veterans talking about, abuse when they were children, all kinds of abuse. Generally, that makes things a little more difficult later in life. Depression, can be, can run in families, things like that. So yeah, no, it doesn't. There's videos just basically from everything, and things that happen afterwards, after service, like the loss of a significant other, a partner, a spouse, even a pet, that all can make, you can get caught up kind of in a cycle of grieving. And after a certain amount of time, if you aren't starting to kind of process that grief and you're stuck in that cycle, people need to reach out for help. And we have veterans talking about those. So that was a long answer. Short answer, any time period.
Awesome. Thank you. And so I'm not seeing anybody pushing out other questions. So I actually do have another one from our Facebook page. And that's, so we have one from a mental health provider who says that they really love the program and the campaign, Make the Connection. They want to know how they can get more involved with Make the Connection as a mental health provider.
Yeah, I think as a mental health provider, that, it's a great question. The best way is to use it in practice. And that's what, we go around the VA, we go to hospitals, we can only do about 3 or 4 a year, but we actually go to VA medical centers and have meetings with both, mental health professionals and VA employees that are not mental health professionals, and encourage them to use the resource. I mean, it's a really kind of a low lift if you know that a veteran is having a hard time with an issue, whether it's, a transition challenge, say, kind of going back to school and the readjustment for that, or if they're having, pretty, whether it's just, PTSD symptoms, you can, encourage them to just go check out the site and watch a few videos. If you're sitting down in a kind of a session with a veteran, you can say, hey, let's find a video that's relevant to you. And then let's talk about what that veteran experienced and how that relates to what you're going through. Or, we've had instances where mental health professionals have told us, they were working with a veteran who didn't want to tell their spouse or partner about what they were experiencing. So they found a video and said, okay, now go show this to your partner. And then maybe talk about it or don't talk about it. Just say, hey, I want you to watch a video. This is kind of what I'm feeling. And so there's great ways. The other really good one is during like a group session. Because we have these videos called compilations that I didn't show, but the compilations are basically a variety of veterans talking about specific issues. So it could be about PTSD, it could be about military sexual trauma, depression. We have compilations on different types of treatment modalities, so like prolonged exposure, cognitive behavioral therapy. I showed the slide. There's a LGBTQ compilation. There's just Army veterans talking about the mental health challenges they went through. So we have service-specific compilations, and those work really great in group sessions.
Awesome. Thank you for that. And actually, so the very last question that I have, this is something that actually came on our Facebook page today, but that a lot of people have asked me over the last couple of weeks in talking about this presentation is, how do people get involved to do a video for the site? Who do they get in contact with?
Yeah, so that's something that we hear. I wouldn't say frequently, but often, and it's a little bit of a complicated thing because the fact that we have to be careful on how we film for the campaign for a variety of reasons. One, like we don't recruit through the VA, so we don't use we don't go to a medical center and then ask the veterans that are getting treatment there. I think I kind of briefly mentioned that. We will go to a town, obviously, where there's a VA facility because most towns either have like an outpatient clinic, or if you go to a big town, and we usually film in bigger cities because there's more veterans, they have a medical center. But we don't use the people there that work there or anything. And because the reason for that is we don't want a veteran to feel, impelled or compelled, like, oh, if I don't do it, or if I say something bad about the VA, we don't want any sort of that, attachment. We want people to feel like they can say what they want, because we don't script these. We don't ask people to say, oh, the VA is great and my treatment was amazing. We don't ask people to say anything. Now, we do ask, the similar sorts of questions, because we are trying to tell a story about recovery. And so the other thing with our recruiting is that we have a pretty rigorous phone interview process before you even get filmed, and where we'll ask you questions about your treatment, because it doesn't have to be that you're receiving treatment at the VA, but it has to be evidence-based. We have to know from the VA's perspective, based on over 10 million veterans, that the treatment that you are getting from an outside provider is actually what VA knows from a ton of data it works. And so we do this pretty rigorous phone screening, and we want people to be well down the path of recovery, because you don't want somebody to sit down and start asking these pretty challenging questions and have only started working through their PTSD, last week, because that could make them, it could actually put them in a crisis situation, and we have to be very careful with that. And so, because of all of those challenges, we don't just let people send us video. And so basically what we do is, about 6 weeks before we go to a city, we'll start kind of canvassing that town through local VSOs. They could be like have a national presence, but using their local chapters, or they could just be specific to that community. There are a lot of just very community specific VSOs. And we'll just, call, send flyers. Occasionally we'll do some small level advertising. So it's kind of a challenge to get involved. I can tell you, we're going to be in New York in a few weeks, and there'll be some flyers and stuff that start popping up in local BSOs, and you may be able to search for it online. And then there's a number to call if you live in New York. And then next year, we probably won't start filming until the late winter and then into spring and the fall, but we don't at this point know where we're going. So it's a little bit complicated, honestly.
Okay, well, thank you for that. So if there aren't any other questions, if there are, I'm sure we can follow up. You can send me an email or get in contact with Koby or anybody else, so we can figure that out later. Great.
Yeah, and like I said, we'll be sending back some of those videos that we were going to show. We'll send out an email with links to those, and then yeah, absolutely, Kai. Thank you so much for letting us talk. All of us that work on this campaign are just humbled by just being lucky enough to actually get to work on something that's so amazing. If you haven't watched any of these videos, I'd really recommend that you go check some of them out. They're just amazing stories that really show the power of the human spirit to overcome adversity, and it's just, like, again, humbling. So thank you, guys.
Yeah, and thank you. And I will say the LGBT compilation video, we weren't able to show it today because the platform had some issues, but I've watched it and it's a really inspiring, very touching video. So I definitely recommend that.
Absolutely.
And then, yeah, just right before we wrap up, I want to let everybody know about our next presentation, which is also going to be about VA services. So Drs. Jill Shippard and Michael Kauth from, who are the directors of the VA's LGBTQ health program, will be talking about policies and services at the VA in a presentation titled LGBT Veterans Are Welcome at the VA, Policies and Services. And that'll be on Thursday, June 28th at the same time. You can look out for an email from me about that or stay up with our Facebook page. So yeah, with that, I want to say one more time, thank you, Koby, and the rest of the team at Make the Connection and the VA for doing this presentation and for all the work that you're doing for our veterans. So we really appreciate it.
Yeah, thank you guys for the work you're doing too, Kai. Appreciate it. Have a great day, everyone.
Thanks. Bye.